In this video, I'm going to be going through gallstones. Gallstones are small stones that form within the gallbladder. The stones form from concentrated bile in the bile duct. Most stones are made of cholesterol. Gallstones may be completely asymptomatic. They can also cause pain and lead to complications such as acute cholecystitis, acute cholangitis, and pancreatitis. Gallstones blocking the drainage of the pancreas, i.e. the pancreatic duct, result in pancreatitis. Let's talk about the basic anatomy. The right hepatic duct and the left hepatic duct leave the liver and join together to become the common hepatic duct. The cystic duct from the gallbladder joins to the common hepatic duct halfway along its length. The pancreatic duct from the pancreas joins with the common hepatic duct further along. When the common bile duct and the pancreatic duct join, they become the ampulla of Vater, which opens into the duodenum. The sphincter of Oddi is a ring of muscle surrounding the ampulla of Vater that controls the flow of bile and pancreatic secretions into the duodenum. Let's talk through some key definitions. There are some key definitions that it is helpful to be familiar with that relate to the gallbladder and gallstones. Cholestasis refers to blockage of the flow of bile. Cholelithiasis refers to when gallstones are present. Choledocholithiasis refers to when gallstones are in the bile duct. Biliary colic refers to intermittent right upper quadrant pain that's caused by gallstones irritating the bile ducts. Cholecystitis refers to inflammation of the gallbladder. Cholangitis refers to inflammation of the bile ducts. Gallbladder empyema refers to pus inside the gallbladder. Cholecystectomy refers to surgical removal of the gallbladder. And cholecystostomy refers to inserting a drain into the gallbladder. Let's talk about the risk factors for gallstones. The 4 main risk factors for gallstones can be remembered with the 4 F's mnemonic. Fat, meaning patients that are obese. Fair, meaning patients with fair hair and fair skin. Female, meaning female patients. And 40, meaning middle-aged patients. Let's talk about the presentation. Patients with gallstones may be completely asymptomatic, so they may not have any symptoms of the gallstones. If the gallstones are causing symptoms, the typical symptom is biliary colic. Biliary colic is caused by stones temporarily obstructing the drainage of bile from the gallbladder. The stone may get lodged at the neck of the gallbladder or in the cystic duct and cause blockage of drainage and pain, and then when it falls back into the gallbladder, the symptoms resolve. This causes symptoms of severe colicky epigastric or right upper quadrant pain. This is often triggered by meals, particularly high-fat meals, and it lasts between 30 minutes and 8 hours, and it may be associated with nausea and vomiting. Alternatively, patients may present with complications of gallstones, such as acute cholecystitis, acute cholangitis, obstructive jaundice if the stone is blocking the ducts, or pancreatitis. A tom tip for you. Fat entering the digestive system causes a chemical called cholecystokinin, or CCK, to be secreted from the duodenum. Cholecystokinin triggers contraction of the gallbladder, which leads to biliary colic. Patients with gallstones and biliary colic are advised to avoid fatty foods to prevent CCK release and gallbladder contraction. Exam questions may test this mechanism, so it's worth remembering, particularly the link with the chemical cholecystokinin. Let's talk about liver function tests. Firstly, bilirubin. Bilirubin normally drains from the liver through the bile ducts and into the intestines. If the liver function tests show a raised bilirubin, which is called jaundice, and the patient has pale stools and dark urine, this represents an obstruction to the flow within the biliary system. Bilirubin is not able to flow out of the bile duct. Obstruction may be caused by a gallstone in the bile duct or by an external mass pressing on the bile duct, for example, a cholangiocarcinoma or a tumour of the head of the pancreas. Next, alkaline phosphatase. Alkaline phosphatase, or ALP, is a non-specific marker. It's an enzyme that originates in the liver, the biliary system, and the bones. And abnormal results can either indicate a liver, a biliary, or a bone problem. ALP is also secreted by the placenta during pregnancy, so pregnant women may have a raised ALP result. In the context of gallstones, a raised ALP result is consistent with biliary obstruction, or obstruction of flow of bile through the biliary system, if it's also accompanied by right upper quadrant pain and/or jaundice. A raised alkaline phosphatase can also be caused by liver or bone malignancy, primary biliary cirrhosis, Paget's disease of the bone, and many other things. Next, aminotransferases. Alkaline aminotransferase, or ALT, and aspartate aminotransferase, or AST, are enzymes that are produced in the liver. They're helpful as markers of hepatocellular injury, or damage to the liver cells. In the context of gallstones, when there's cholestasis or blockage of bile through the bile ducts, ALT and AST can increase slightly, but there will be a much more significant rise in ALP, or alkaline phosphatase, and this is described as an obstructive picture, referring to the obstruction of flow through the bile ducts. Alternatively, if the ALT and the AST level are high in comparison to the ALP level, this is more indicative of a problem inside the liver with hepatocellular injury, and this is described as a hepatitic picture, as opposed to an obstructive picture. Let's talk about the use of ultrasound. An ultrasound scan is a useful first-line investigation for symptoms of gallstone disease, for example, abdominal pain, right upper quadrant pain, and jaundice. An ultrasound scan is the most sensitive initial imaging test for gallstones. CT scans are not good at identifying gallstones or biliary disease. The use of an ultrasound scan is limited by the patient's weight, for example, if they're obese, gas filling the bowel that might obstruct the view, and any discomfort that the patient experiences from the ultrasound probe. Let's talk about ultrasound scan findings. An ultrasound scan can be helpful in identifying gallstones in the gallbladder, gallstones in the ducts, dilatation of the bile duct, which may be caused by a distal obstruction causing the proximal bile duct to swell up. And remember that the normal diameter of the bile duct is less than 6 millimeters. Acute cholecystitis, where it may be possible to see a thickened gallbladder wall, stones or sludge in the gallbladder and fluid surrounding the gallbladder. And it can also be used to assess the pancreas and the pancreatic duct.